Here are some USMLE-style questions on autoantibodies to presynaptic calcium channels, which is associated with Lambert-Eaton myasthenic syndrome, LA. Question 1. A 62-year-old man presents with progressive weakness over the past 6 months. He reports that his weakness is worse in the morning but improves with activity. He also complains of dry mouth and erectile dysfunction. On examination, deep tendon reflexes are decreased, but improve after brief muscle activation. Repetitive nerve stimulation shows an incremental response in compound muscle action potential, CMAP. Which of the following is the most likely underlying pathophysiology? A. Autoantibodies against postsynaptic acetylcholine receptors. B. Autoantibodies against voltage-gated calcium channels. C. Autoantibodies against glutamate decarboxylase. D. Autoantibodies against presynaptic vesicular proteins. E. Destruction of anterior horn cells. B. Autoantibodies against voltage-gated calcium channels. This is Lambert-Eaton myasthenic syndrome, LEMS, caused by autoantibodies against presynaptic voltage-gated calcium channels, VGCC. Symptoms improve with activity, unlike myasthenia gravis, which worsens with use. Hyporeflexia that improves with exercise is a classic finding. LEMS is often paraneoplastic, commonly associated with small cell lung cancer. Question 2. A 58-year-old man presents with proximal muscle weakness that has progressively worsened over the past 4 months. He also reports dry mouth and occasional dizziness when standing. Physical examination reveals hyporeflexia, and repetitive nerve stimulation shows an incremental response in CMAP. A chest X-ray reveals a mass in the right lung. Which of the following is the most likely associated malignancy? A. Small cell lung cancer. B. Thymoma. C. Renal cell carcinoma. D. Adenocarcinoma of the lung. E. Hodgkin lymphoma. Answer. A. Small cell lung cancer. LEMS is a paraneoplastic syndrome associated with small cell lung cancer. Small cell lung cancer originates from neuroendocrine cells, which express voltage-gated calcium channels, leading to autoantibody production. Question 3. A 55-year-old man presents with weakness that has worsened over the past several months. He has difficulty standing from a seated position and climbing stairs. His symptoms improve with exercise. On examination, he has decreased deep tendon reflexes, which temporarily improve after brief muscle activation. He has a 40-pack-year smoking history. Which of the following additional tests is most important in evaluating this patient? A. Acetylcholine receptor antibody test. B. MRI of the brain. C. Chest CT scan. D. Muscle biopsy. E. CSF analysis. Answer C. Chest CT scan. This patient likely has Lambert-Eaton myasthenic syndrome, LEMS, which is strongly associated with small cell lung cancer. A chest CT scan is the next step to rule out malignancy. Acetylcholine receptor antibodies, answer A, are used for myasthenia gravis, which presents with worsening weakness with use. Question 4. A 60-year-old woman presents with fatigable weakness that improves with use. Reflexes are diminished at rest but improve after exercise. Electrophysiologic testing shows a progressive increase in compound muscle action potential, CMAP, with repeated stimulation. Which of the following best explains the underlying mechanism? A. Increased synaptic acetylcholine release. B. Reduced postsynaptic receptor density. C. Demyelination of the peripheral nervous system. D. Destruction of motor neurons in the spinal cord. E. Increased neurotransmitter reuptake. Answer A. Increased synaptic acetylcholine release. In LEMS, autoantibodies against presynaptic voltage-gated calcium channels inhibit calcium influx, leading to reduced acetylcholine, ACH, release. Repeated stimulation temporarily increases CA quartipide entry, leading to improved neurotransmitter release, explaining the incremental response in CMAP. Would you like more questions?